Now, the World Health Organization has said that 5 of the 8 suspected cases of hantavirus linked to the cruise ship MV Hondius have now been confirmed. The ship is currently heading for Spain's Canary Islands. That's after setting sail from Argentina a month ago. The World Health Organization is warning that more cases are possible, but officials have also stressed that the risk to the wider public is low, and this is not a precursor to any kind of pandemic.
This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those out there who are asking these types of questions. But this is not the same situation we were in 6 years ago. It doesn't spread the same way like coronaviruses do. It's very different. It's that close, intimate contact that we've seen. And most hantaviruses don't transmit between people at all. Most hantaviruses are transmitted from rodents or their feces or their saliva in their droppings to people. And only this one particular virus, the Andes virus, which has been identified here, we've seen some human-to-human transmission. And again, I want to reiterate, the actions that are being taken on board are precautionary to prevent any onward spread.
Well, health officials from several different countries, including the United Kingdom, are working to trace passengers who left the cruise liner before the outbreak was confirmed. The MV Hondius left Argentina on the 1st of April. 10 days later, on the 11th of April, the first passenger died, a man from the Netherlands. The cruise ship continued onto the remote South Atlantic island of St Helena, where the wife of that man disembarked with his body. She then travelled on to South Africa, where she later died. She is a confirmed case. And we now know that some 30 passengers in total disembarked in St Helena. 7 British, 6 from the United States, 3 from the Netherlands, 2 from Canada, Switzerland and Turkey, and 1 case each from Germany, Denmark, New Zealand, Singapore, Sweden and the Caribbean island of St Kitts and Nevis. All 12 countries have been contacted by the World Health Organization. We already knew about 2 British people who are self-isolating at home now and who flew back to the UK. Neither had symptoms, but they did contact the authorities when they heard about the cases on board the cruise liner. Well, the ship then continued its trip, dropping anchor off the coast of Cape Verde on the 3rd of May. And this is the current position of the vessel. The remaining passengers and crew are sailing to the Canary Islands, where they could be allowed to disembark on Saturday if they do not appear to have any symptoms. Well, our correspondent Guy Hedgecoe has the latest developments on the ground in Tenerife.
Here in Tenerife, I think it's safe to say there is a certain amount of unease at the prospect of this boat arriving at the island either on Saturday or Sunday, which is when we're expecting it. Local people I've spoken to have expressed concern, in some cases some nervousness or even fear, because they see this possibly as a repeat of COVID, or certainly COVID is fresh in their minds. And also we've seen, for example, local dock workers have threatened to block the arrival of the boat the weekend because they say there hasn't been enough information given to the local population and to local workers. Now, there has been a meeting today between health ministry authorities and the local government here in the Canary Islands. The local government had spoken out very strongly against the arrival of this boat, saying the guarantees didn't seem to be there in terms of safety and there had not been enough information. But this seems to have been quite a constructive meeting, and what has come out of it, certainly from the Canary Island government, has said that during that meeting they discussed details about how the boat won't actually dock at a port in the Canary Islands, but it will be out at sea, it will anchor there, and then the passengers will be brought in a smaller boat to Tenerife. And so they seem very keen, the authorities, to insist that this is going to be a safe operation.
That's our correspondent Guy Hedgecoe there in Tenerife. Well, following on from that earlier news conference, the World Health Organization said that it is working with health authorities in South Africa, and our correspondent there is Pumza Filani, who's in Johannesburg with more details.
One of the other things they mentioned there is that the one British patient who is being treated here in South Africa is now starting to show signs of recovery, seems to be on a recovery track. And tied to that, on the sidelines of monitoring his recovery, authorities are also trying to track down at least 82 passengers and 6 crew members who would have come into contact with the Dutch national who flew here to South Africa to meet, to try and repatriate her husband's body back to the Netherlands, the lady that you mentioned there who later died in a separate hospital here in South Africa. Authorities have said that while they largely believe the risk is minimal, they do want to err on the side of caution. So the airline, Air Link, that flew the passengers that had that woman in the plane on the 25th of April have confirmed to us that they've handed over all the necessary details and that the health authorities have then are working on the process of contacting them so that monitoring can continue over the period of the next few weeks to make sure that people don't later then show symptoms.
Pumza Fulani reporting there from Johannesburg. Well, Sabra Klein is Professor of Molecular Microbiology and Immunology for the Johns Hopkins Bloomberg School of Public Health. And I've been talking to her about this virus, and she told me what kind of virus it is.
Hantaviruses, as was noted in these news conferences, they are carried by rodents, and that's how we get exposed to them, through exposure to their excrement. And really it's that the virus can be aerosolized, so we can breathe it in from rodents. In this case, I think there's growing concern that Andes virus, which is the hantavirus that these passengers have been exposed to, can, in rare cases, be transmitted through human-to-human contact. But unlike SARS-CoV-2 or even influenza, this requires very close contact, often with bodily fluids. So it is still very low risk of exposure, but the long incubation period, as was noted by the WHO, up to 6 weeks, is why passengers have been being quarantined.
Yeah, so I suppose with that long incubation period, it's hard to be absolutely certain of anything.
This is so true, and very different, again, from SARS-CoV-2, where you start developing symptoms within a few days of exposure. To think that you may not develop symptoms until 6 weeks after exposure creates a very different scenario for quarantining people with known exposures.
And I suppose with all these people being on the ship, this cruise liner, they were in close proximity to each other, and that is one of the reasons that this spread so rapidly.
So it's not merely that you have to be in close proximity, because unlike influenza viruses or coronaviruses, that can be carried in droplets from our saliva, and just a little bit goes a long way. For hantaviruses, which are very rarely contracted through human-to-human spread, it's really only this one hantavirus, Andes virus, that has been in rare instances shown to be spread through human-to-human contact. It really does require a significant amount of exposure, typically to bodily fluids. So, you know, it would be a lot, it would be a much more extended exposure to lead to this. But there are those instances of super spreaders who are just, they have such high viral loads, they're able to spread it. So it's looking like more and more that's what we might have here on this ship.
And just briefly, in terms of how dangerous it is, I mean, this Andes virus, it's pretty deadly, isn't it? It has a pretty high fatality rate.
This is. So again, while risk to the public is low, and this does not have pandemic potential, this is a hemorrhagic fever virus. And as you noted, Andes virus in particular has about a 30 to 40% fatality rate. So it is a very deadly virus, as are many hemorrhagic fever viruses.
That's Sabra Klein, who's Professor of Molecular Microbiology and Immunology.